Can you associate all the following signs and symptoms to a single disease? Have a look. A female aged 18 years and a student had consulted with complaints of severe stamba and ruja in Griva Pradesha, causing extreme difficulty in moving Griva since 5 years, recurrent episodes of Shirashula during evening hours since many years, Anidra since many years, and the patient had a very low body weight since childhood. She was 33 kgs when she was 18 years old. Though the major concern of the patient was all these symptoms, a long and deep Prashna Pariksha with the patient revealed that she was also suffering from Atishaya Dravamala Pravritti and Admana on intake of milk since many years, Annadvesha and Aruchi during morning hours since many years, Sholayukta Alpartava Pravritti since menarche, and frequent passage of sticky stools since many years. The prakriti of the patient was understood to be Vata Pittala. Though all the signs and symptoms observed in this case grossly pointed out towards involvement of Kupita Vata in the case, no major Vatakara Nidana was elicited in the case. Except for long history of Pramitashana, which was due to Aruchi, no history of Asamyak Ahara and Vihara was observed in the case. So, what might be the root cause of all Kupita Vataja Lakshanas in this case? And what would be the diagnosis and treatment of this case? If we adopt a fragmented approach in diagnosing this condition, like that of Western medical science, we will intend to diagnose all individual symptoms as that related to different Vata-related conditions and will accordingly prescribe Vatahara Aushadhas for Griva Shola, Rajah Pravartaka Aushadhas for Alpartava Pravritti, Brahmana Lehyas for Karshya, Deepana Pachana Aushadhas for all Agni Dushti related signs and symptoms. But will this cater to the need? No. Instead, on emphasizing the holistic orientation of samhitas that is advocated in diagnosis and on successfully applying it, it was understood that the diagnosis of this case was Vataja Grahani, as it had the cardinal symptoms of Vataja Grahani, that is Karshya, Griva Ruja, Admana, Aruchi, Anidra. And sticky stools, Dravamala Pravriti, etc. was secondary to Ama Lakshanas, which is also the cardinal symptom of Grahani Dushti. Sholayukta Alpartava Pravritti too in this case was a consequence of Kupita Vata and Rasa Dushti, which again are caused due to Grahani Dushti. And for my amusement, the Nidana of Grahani in this case was Karshya, or the Krisha Kaya which the patient had since her childhood. As goes the verse in Samhita, Krisham prayobhidavanti rogascha grahani gataha. Acharya Charaka in Sutrasthana 21st Adhyaya and 14th verse mentions about this condition. So after understanding the case to be so, the case was successfully treated by administration of Chikitsa of Vataja Grahani. Hingvashtaka Churna with Anna initially was administered till patient was relieved from Aruchi and Annadvesha. Shamananga Snehapana with Gugulu Tiktaka Grita in Hrisva Matra was administered with Jiraka Kashaya as Anupana till proper Snehana and Agni Deepti was attained. Yoga Basti with Vatahara Aushadhas were administered after few days of Snehana. Patient had significant improvement in Griva, Shula and Stamba immediately after completion of Shamananga Snehapana. It was completely reduced. Other symptoms gradually got reduced after Vasti, Nityabhyanga, and after following the advised Vatahara, Ahara and Vihara Niyamas as advised. The takeaway for today is certain key factors needed for arriving at accurate diagnosis according to Ayurveda might go unnoticed if diagnostic parameters of Western medical science alone are used as the tools for Ayurvedic diagnosis. Example, understanding Karshya, Griva, Shola and Alpartava Srava as a consequence of Grahani seems impossible and irrelevant from the perspective of Western medical science. Association of Karshya to Grahani is exemplary and explicit to Ayurvedic orientation alone. Number 3. Nidanas might be outside the realm of Ahara, Vihara and Manasika Bhavas too. As in the case presented, Nidana of Grahani was untreated Karshya and Nidana of Karshya was untreated Grahani. Thank you for now.